On today's episode of the CLS Experience, we have a very delightful treat. He's a board-certified orthopedic physical therapist that specializes in the treatment of pain and movement disorders, an upcoming author, and the founder of Rehab Science, which is also one of the world's largest social media accounts dedicated to physical rehab. No big deal. He was also a full-time undergraduate kinesiology professor, where he taught human biomechanics, therapeutic exercise, and pain science, just to name a few. He received his bachelor's degree in exercise science and his doctor of physical therapy degree, just adding to his already super impressive resume. Big facts. His ability to teach others how to treat pain and injuries on their own is second to none, and he's just a juggernaut in all facets of life and a terrific human. Please welcome the intelligent, dynamic, and wise, the handsome and detail-oriented, tenacious Dr. Tom Walters. How you doing, Doc?
Dude, Craig, that was the best intro I've ever had. That was amazing. Thanks, man. Thank you. Excited to be on the show, dude. Just I nerd out on this stuff and excited to be here and chat with you about it.
We're going to have so much fun. Oftentimes, like I connect with the guests before, but there was a lot of alignment right now. We're talking about kind of reinventing and going for it and entrepreneurship. This is going to be so much fun. I'm so excited. For our listeners, if you're not familiar, my best suggestion is to do a deep dive, play catch up. By the time this episode airs, you're going to be able to grab Doc's book, which I want you to do. We're going to put that in the show notes. What I think is most valuable today is we just have an unbelievable conversation. Before we dive in, we're going to get a little weird. You ready for me?
I'm ready. Let's do it.
Doc, when you wake up every day, what are some non-negotiables for you?
Yeah, I would say non-negotiables are I've got two daughters and my wife, and I think just making sure I have some focused kind of quality time with them where I'm present. And that's hard because I post every day. I'm active on social media in the morning, but trying to make sure that that's handled. I'm disciplined about that and taking care of that, but then setting time aside to be kind of present with them as their day is starting and they're getting off to school. So that's really at this stage of my life, probably the major non-negotiable is just being present with them before they take off. Of course, it's totally different. Excuse me. Different now, yeah, being a parent than what it would have been like back when I was, we were first married and I was single, but that's that would be the primary non-negotiable these days in the mornings.
It's so good and so meaningful because something that I realized and take pride in saying is what success is not is dominating in just one area. Like you got to be all around, right? Like a seven-figure earner, but also seven-figure dad, seven-figure husband, seven-figure human being, and all the things. So I'm so glad that you said that. And one thing that I'm really working on is being super mindful and present, right? Like no matter what I'm doing right now. Well, first of all, right now, I don't care about anything else in the world other than having an unbelievable conversation with you. But I carry that now with every activity, even if it's walking my new puppy or chilling with my fiance or on a coach, whatever it is, just be 100% there. And what I've noticed is mindfulness is the portal to expansion.
Mm-hmm. Yeah, no, I totally agree. And like you said, it's challenging, right? It's not easy to do. It's a discipline you have to cultivate, and I'm not perfect at it, but yeah, just trying to be present with the things that are important to me are huge and the main focus in those mornings right now, because it's a short window of time. It's like you got an hour or whatever, and it's easy to get distracted and think, oh, you've got this every day and take it for granted. But and just like you said, it's really been a goal for myself, thinking about success and what that means. And there are people, right, you hear this a lot of times, that people who are really uber successful in one area, they're usually focused in just that one area. And I would rather have success in my life be a little bit more of a balanced looking type of success, where I don't take time away from my family and my kids. It would be the worst if I were to grow Rehab Science and positively influence more people in the world who have pain and injury, but lose my family in the process. That's not success to me. So I need to figure out a way to balance those things and give where I can. And so, yeah, that's where I'm at.
Hell yeah. Love all this. And one thing that you're doing, as am I, took me 35 years to figure out, but you're doing what you love. And it's obvious, brother. It's contagious. And I imagine that's one of the reasons why you're so excited to do stuff, whether it's the book or content or have conversations like this, because you can't talk about this stuff enough. Is that right?
Oh, totally. Yeah, I am hugely passionate. I feel grateful every day for what I'm doing, because there was a period of time where I was still in this space, but it wasn't quite the right framework or the right output for me to feel happy and feel like I was really getting a feeling like I was doing something meaningful. It was still meaningful, but it was just different. And I think where I'm at now, having the ability to affect large groups of people on a large scale, positively help people who have pain and injury is, I just feel I'm so thankful for it. And I have to kind of pinch myself because it's strange how it got to this point. I would have never expected. I didn't go into this with the goal of making that happen. Just a lot of factors came together, but I'm so grateful for it. And I just, like you said, spend my whole day talking about things that I'm super passionate about. So I have a never ending amount of energy for these topics. And it's always cool when you find other people. I mean, you can see this coming from you too, where they find this thing that it meets all these kind of needs, and you can just see the energy kind of emit from them.
Hell yes. And for the listeners, I would never give up on finding what that is for you. And I used to hear people say to me back in the day when I was on Wall Street, like, oh, find what you love and you'll never work a day in your life. And I used to be so skeptical. I'm like, right, okay. It'll always feel like a job. No, it is not. Like, this isn't work to me. People literally say to me, what are you on? I'm like, you don't get it. It took me 35 years, but now, first of all, it doesn't take time. It just takes alignment. So for you having all the success that you're having, helping so many people, I'm not really surprised because you're adding value and you're doing what you love, and it's an energy and it's just an energetic exchange.
Yeah, I couldn't agree more. Yeah, it's so true. If people just, I mean, I taught undergraduate, young college students for 10 years, and a lot of the discussion was around this, trying to help them. And there's a lot of talk about this in the world and podcasts and everywhere these days, but just trying to find that thing that matches up with your personality, your interests. You put all these things together, find that thing you're passionate about, because it won't, there's going to be times where there's aspects of anything you're doing where you like some things better than others. But when I look at all the things I do right now, I'm excited about, like, when I think about the whole thing together, I'm so excited about it. And yeah, you just hope that, we were talking earlier, but a lot of people, I think, are unhappy in the situation they're in and see something else that maybe would match their passion and interest a little better, but taking that risk to take the leap of faith and kind of go for it. A lot of people don't do that. And I think that was something, especially when people are young, trying to encourage them to take these sort of, my kids at school, they always talk about responsible risks, but it's like, responsible risks are huge. Like, you try to find things that you're sort of, mostly prepared for. And then when doors open, don't be afraid to kind of take those risks. It was a huge part of what got me to where I am now. Because I could have just come out of physical therapy school like every other physical therapist. Most physical therapists are not very entrepreneurial and just get into a clinic job and they stay there for their whole career. Maybe they change to a different clinic a couple of times, but that's just not how I'm wired. And I'm glad I took those risks early on, because it led to this thing that I couldn't have imagined back then.
Same. And this is only negative I got going on is we don't have 10 hours to chat, but I know we'll just get warmed up. And I want to talk about all the exciting stuff that you're up to now, but I'm just curious. You mentioned that, and we were talking before we record, that most people aren't doing what they want to do, or they're not taking that calculated risk to pursue what it could be that they're here for or want to do. Why do you think so many people don't take that calculated risk?
Yeah, I think for a lot of people, as I've kind of analyzed them over the years, I think a lot of it boils down to fear, sort of insecurity about whether or not they measure up to can they take on this challenge? I think a lot of it's comfort based, right? It's like, I'm comfortable here, and it's hard to entrepreneurship is often uncomfortable. There's quite a bit of instability and volatility. You don't know what you're going to be bringing in, what's going to happen every month. It'll be a little bit different.
Facts.
Yeah, like, you have to have a certain degree of, you have to be possess a certain degree of resiliency to kind of, and just know that, I think, going into it. And I don't know that everybody's cut out for that. It's hard for people to leave their comfort and safe zone. And because I've talked to lots of people over the years, other physical therapists especially, that healthcare has a lot of problems, and there are a lot of physical therapists that are really burnt out. The average time that a physical therapist stays in the field is about 9 years before they totally change out of the field, which is sad because you go to get a doctorate.
I didn't
You're
know that.
Yeah, you're in school for a long time, and so It just the healthcare system, having to see so many patients, it burns out a lot of PTs. But so I hear this from a lot of PTs, but they also just won't take the risk to try something entrepreneurial. And I think, partly they're not educated and trained in business, and I wasn't really either. But I think they also just it's too scary to leave that comfortable spot.
Yeah, I think people maybe feel a little unworthy, or they fear what happens if they fail, or even worse. And I've been there, if I'm being honest, but I was able to overcome it. Fear what others think. You know, but ultimately, like, not to sound too cliche, but we get one shot at this thing called life. In terms of this human experience, not souls and spirit, that's a different conversation. But ultimately, if you step into something and lean into something, it might not be the thing, but there's a good chance it's the thing that leads to the thing, right? And for anyone listening, like, entrepreneurship is challenging. Spoiler alert, right? And you better negotiate the price in advance, because there will be ups and downs. But if you're pursuing what you love and you feel like you're contributing, making an impact, it will all be worth it. I stand by that.
For sure. Yeah, I couldn't agree more. And those are all those aspects you mentioned are totally true. I mean, it's just, yeah, people worry about what other people are going to think and the failure side of it. I've had businesses fail, but there's a ton of evolution, that personal evolution that comes from that. And where I'm at now is completely influenced by those, if you want to, failures, like learning experiences, right? I mean, they shape who you become. And if you don't do those things, then that evolution is slower and probably less significant.
Hell yeah. This is great. The new book.
Yeah.
This is your first one, correct?
First book. Yeah. Yep. Pretty excited. It's super exciting.
Why this one and
Mhm.
why now?
Yeah. So this book is why I do this book was that all these years that I've been on social media, so basically back in 2016, I started really started on Instagram, and not really with a not really knowing what the potential there wasn't much talk about that back then. I just wanted to put out positive content that addressed common injuries and pain and questions that people came to physical therapy with. That was my goal. Just every day I'm going to try to do this. And so over the years, I've just seen how many people around the world, pain is such a huge global problem. And you imagine the number of injuries, pain issues going on around the world. It was obvious to me on social media how much of a need there was for this. And it was also really cool to see that these educational kind of simple posts that I could do that were partly educational, partly showing exercises, how powerful they could be. I mean, I'd interact with people all around the world who would get better from these simple posts, which was sort of unbelievable to me, because they're obviously a very distilled down version of what would happen if somebody actually came to see me for physical therapy. I can't touch the person. I'm not giving nuanced sort of exercises based on their specific symptoms, but I saw how powerful those posts were, but also recognized at the same time that social media doesn't allow for a lot of nuance. I can't go into extreme detail. And so why write the book was really to create a resource that basically has everything I've ever written. The book is 496 pages. It's a big, thick textbook for the regular
Oh,
person,
yeah.
but it's the whole body. It's pain information, pain science information, injury science information, and then programs that are similar to what I do on my Instagram, but more comprehensive and can speak to more of that nuance for people that have these. Most humans have, we sort of follow the same patterns and have the same kind of pain issues and injuries. So the book covers the 50 most common, and really, like I say, most humans will kind of fall into those, and if they don't have them now, a lot of them we will experience at some point in our lifetime. And so that was a lot of the why I do this book. And you know it it happening right now was actually just another one of these doors that opened that I said yes to. My co-author in the book, a guy named Glenn Cordoza, is an amazing author. Last 20 years has been writing MMA books and health and fitness books, and so I knew him from other books, and he reached out to me, and it was just one of those things where I was like, I have to say yes to this. It's an amazing opportunity. A door is opening. I'm going to go down this road. And that was 2.5 years ago. It was the beginning of 2021. And now I'm here. This book is done. It's going to release next Tuesday. People around the world are going to get it, and it's going to start helping them. And it's just an extension, a more powerful extension of what I do online. And I mean, I can't be more pumped.
Yeah, I can tell. I mean, anyone can tell listening to this. First of all, I want to acknowledge you. It is going to help a lot of people. I love the fact that like this opportunity came and you felt called. Like I have to say, yes, it was in alignment. And also, this is going to be such a good resource for so many people because it covers so many different things that you often talk about. And it's in one spot, like one vessel, so to speak. I imagine there's some people out there that follow your work or maybe even not, but don't know some of the terminology that you talk about often. Like, for example, how would you describe pain science?
Totally. It's a great question. Yeah, pain science is really exploded in the last 15 years, but the general public wouldn't know that. It's really the clinicians and practitioners, and there are certain resources that have been created for the general public, but pain science is kind of just it's studying pain and like what is pain. Our understanding of pain has changed a ton, even since I graduated from physical therapy school in 2007. We used to think of when people had physical pain, you would think, oh, you had an injury, like you sprained your ankle or you strained your back or something like that. And for sure, there are people who have pains like that are very tied to the physical body. But pain science, this study of pain, there are individuals who have PhDs just in pain who just study this. And we've found pain is this much more complex experience that comes from the brain that's influenced by not only your physical body, but your thoughts, your emotions, your social support system. It's really a whole mind body sort of experience. We look at it from something called the biopsychosocial model because we have to consider all these aspects. Some people who have pain don't get better with the really physical, mechanical sort of interventions that we used to always implement in physical therapy, looking at posture and biomechanics and the person's anatomy. Some people really only get better when we think about their mental health and their stress and their nutrition and how sedentary they are. There's all these other factors that go into pain. And so the book really focuses on pain science in the beginning because a lot of people probably won't read that right away. They'll go right to a program that talks, addresses their issue. But I hope that people will come back to pain science because we have more and more research showing that the more people learn about pain, the less anxious and fearful they are of pain. And it sort of gives them this ammunition or kind of protective armor the next time they're injured or have pain.
I'm so happy I asked you that because I didn't know about all the mindset stuff. And I wanted to ask you later in the conversation if there was a correlation between mindset and recovery. But it seems like you just touched upon that based upon the definition of pain science. Is that right?
Yeah, it's huge. It's huge. There's a lot of studies showing that your mindset can influence outcomes in how fast or to what level you get better and the risk of re-injury. So we have all kinds of studies on this. For instance, like take an MRI. You have back pain, you go get an MRI. Studies have basically shown now that if somebody has back pain and gets an MRI right at the beginning of care, their recovery is often worse if the MRI shows something that is scary to them, like, oh, I've got stenosis, or I've got degenerative disc disease, or I've got a bulging disc. If people see that and hear about it, they will do worse in their rehab and recovery. So now the common practice is if you don't have certain symptoms, you just have back pain, we don't even let you get an MRI because we know it will influence your mind and that will influence your physical body and your pain. So people aren't even really allowed to get these things early. If you look at something like an ACL tear, the fear of re-injury is sometimes worse than the actual injury. Athletes who tear their ACL, if they have score highly in terms of fear of re-injury, we see that the likelihood of injury on that same leg or the other leg is higher based on kind of that mental state and their fear.
So fascinated by this because I believe it has, like, for example, my pops, no spring chicken. He's 87 years young. They had me a little bit later. And I'll never forget over 5 years ago when the doctor came in to give him the prognosis that they found stage 4 lung cancer. And the doctor was very negative. And I get it. Like sometimes doctors want to protect themselves, whatever the case may be. But what about like maintaining an optimistic approach or being somewhat realistic, but also having faith and hope? And here my dad is, and we just got great news and he's still trucking on. And I've seen other people who get diagnosed something like that, and right away they feel defeated. And then it's up for them like in a couple months. So, I imagine that's not a coincidence, but to hear it with injuries like that maybe aren't life threatening, that's so interesting to me. And I'm so fascinated by the correlation between all this stuff, like energy, vibrations, the mindset, and the body. That's pretty groundbreaking stuff. I imagine most people didn't realize that.
Yeah, the mind is plays a huge role in pain and injury. And just like you talked about, what practitioners say to people has a huge influence on
Yes.
their energy, what they say, the words they use. We have all kinds of studies, in my world, a lot of it is on chronic low back pain, because so many people, low back pain has an 80% lifetime prevalence. 80% of people will have low back pain at some point in their life. And certain words really make people feel like they're not going to get better. Like just the term chronic back pain, or using even the phrase wear and tear. We don't really use that anymore. You'll hear a lot of doctors use it, but in the rehab world, we really try not to, because we've seen in the studies that those phrases and language can really harm people. It's the opposite of the placebo. It can create a nocebo, where just the information can be harmful to them and negatively interfere with their ability to get better.
Yeah, I believe it 100%. And I'm happy to hear that you and like people now are intentional with the words that they speak, and wear and tear. I mean, that does sound pessimistic, if we're being
Yeah.
honest.
Yep, for sure. Yeah.
Yeah, this is great stuff. You mentioned lower back pain. It's funny because I'm not surprised to hear the percentage is so high. It seems like everyone I know at some point has had lower back pain, myself included. I'm just curious, would you consider sciatica to be in the class of lower back pain, or not really? Because it's like a nerve down your butt and leg.
Yeah, sciatica, in most cases does have a low back contribution, because your sciatic nerve forms from the nerve roots that come out of your low back. So you do have some people who have sciatica that's more of a pelvic kind of hip region sciatica. Like some people may have heard of the piriformis syndrome kind of thing. That name has sort of changed, but there are some sciaticas that can be related to like where your hamstrings attach up in your hip region. Some of your deep hip rotator muscles, your sciatic nerve runs underneath them and beside some of them. And so, but in a lot of cases, most cases, sciatica, I would classify as kind of in that low back pain kind of category. So, yeah, and that's a huge one, right? Like that's another one that is one of the things that gets the most engagement when I talk about it. So it obviously affects a ton of people.
No fun. It affects me. I used to have it worse. I was in a car accident. That wasn't so crazy. I was in a taxi in New York City probably like 10 years ago, and I was rear-ended. And then, it didn't seem too crazy, but then did some testing, and it looked like I had sciatica, like there was like a nerve that was inflamed, whatever the case may be. And when it comes and when it flares up, it is debilitating. I mean, it's like I have to crawl to the bathroom. It doesn't come that often anymore. For some reason, when I started running, maybe just a coincidence, or I'm just being super optimistic, but like it kind of like stayed at bay. But it'll come like once a year for like a week. And when it does, I mean, it's like, it's very humbling, sciatica. Is there a better way to treat it, or anything you might suggest? Because I know a lot of people have it.
Yeah. Yeah. It's a lot of people have these experiences like you do, where when it does kick on, it's sort of unpredictable and really, really intense, and they are really debilitated by it. I don't think what you're saying is a coincidence. A lot of these pain disorders get better when people move more, which is sort of counterintuitive to people a lot of times, because you get injured and have pain in your physical body, their natural response is to protect it and move less. And so we really try to, you want to respect an injury when you first have it and let it kind of heal and desensitize, but you still want to be trying to incorporate movement. And as that thing heals, you really, with different movements and exercises, you really can reduce the reoccurrence rate, especially when you look at low back pain. And there are lots of studies on this. I don't know if running gets included, but walking is cited a lot for low back pain, for chronic low back pain kind of symptoms. And running has a similar, right? Like your legs are moving opposite directions, that it kind of keeps your spine in neutral, and it moves the spine. And movement at the end of the day is one of the most powerful modulators of pain. Movement is huge for pain. Our brains, our nervous system loves movement. We have studies showing that people who are more sedentary actually have an increased level of inflammatory cytokines. This is immune system molecule in their bloodstream. So the more sedentary you are, the more of these inflammatory cytokines you have. And I think our nervous system really benefits from movement. But yeah, when you look at something like sciatica, not only those kind of general movements like walking and maybe running when somebody's ready for it. If you look at these studies, lots of different types of exercise or movement strategies have evidence for back pain, and everything from yoga, Pilates, stretching programs, resistance training, all these things can have a significantly positive impact on back pain. And so at the end of the day, we're always trying to get people to move more, right? It depends. I'm in California and people here often move too much, and I'm trying to get them to modify and rest a little bit. But most of the rest of the country, people don't move enough. They're very sedentary. And so it's trying to find things that people actually like to do, because then they'll be consistent with it. And when they're consistent with movement and exercise, they tend to have less flare-ups. But when you look at something like low back pain, getting somebody just to move generally with an exercise type they like is great. But then, yeah, with sciatica, there's certain types of spinal mobility exercises that tend to reduce sensitivity in the sciatic nerve. And then we have a lot of research for posterior chain strengthening for low back health, which is exercises that strengthen the backside of your body. So things that would strengthen like your hamstrings, your glutes, your low back muscles, your low back extensors. So those types of exercises, when the person is kind of calmed down, seem to be some of the best for reducing the likelihood that you have another back pain episode. So it could be things like hamstring curls, bridges, deadlifts. Sometimes we have these people do these like Superman ones where you lay on your stomach and arch your back and lift your arms and legs. So all these exercises that strengthen the back side of your body can be pretty helpful for back pain.
I mean, this is so valuable. We're helping so many people in this conversation. I'm so glad I asked you that. And I know a lot of people suffer from back pain, but bottom line is one of the main things I took away from that is get moving, move your body around.
Yeah, it's huge. It's huge. And you can't dismiss other factors too when it comes to pain, because pain is so multi-dimensional. Sleep is one of the biggest things. A lot of people who get into pain issues have issues with their sleep, and then it creates this kind of positive feedback loop where the two feed off each other. But sleep is huge for the pain system and the musculoskeletal system. We heal and remodel at night, so sleep is a huge one. And then we were talking earlier about thoughts and emotions, but your mindset and kind of stress, those things really feed into pain too. So that is another huge aspect. I would say kind of sleep, exercise, movement, and then stress and kind of things like that.
You're such a stud. I'm just curious, is fitness a big part of your routine?
Oh, huge. Yeah. My whole life. Yeah. Yeah. It's probably my other identity. I mean, that was my main identity before I became a physical therapist. I grew up as a gymnast and taekwondo. I did taekwondo jiu-jitsu. So I was a martial artist and a gymnast all through from basically age 10 on. So which was amazing, that experience, because it feeds so well into what I do now as a physical therapist, but especially martial arts and gymnastics, because I learned so much body awareness and control. I was always barefoot. I was always balancing. I was moving my joints in all planes of motion. And so now when I reflect back on that as an orthopedic physical therapist, I can see how useful those sports were to just the development of my musculoskeletal system, my nervous system, my brain, all that stuff. And exercise is a form of it's probably my primary thing I use for my mental health. So, do you see, you can understand it when people get injured and they come into physical therapy, they're often pretty down and depressed, because it means that exercise or movement thing that was helpful to them on a lot of levels, they can't do at the same level. So, yeah, but it's a huge part of who I am and what I do. And, one of the things I enjoy the most is just moving and being fit. I don't do anything crazy anymore, but run and lift, and that's what I like to do.
Yeah, I'm the same way. For me, I work out 7 days a week, non-negotiable if I can help it. And it's not so much the physical component anymore. Yes, it's great to look good and obviously feel good. But for me, it's just the mental. It's like where I do my best connecting and thinking and ideas, and I get some momentum and it just move around and create good energy. I just love it so much. And for anyone out there, like, it's not only about the physical, right? Like, that's a little bit of immature thinking, like validation, how you look. I used to be that cat. But it does so much more for your mindset and for your energy and just being positive and endorphins, and the list goes on.
Yeah, no, it's huge. I'm in the same boat. I mean, I'm 41 now, and there's a part of me that's
41 years young.
41 years young, baby. I mean, I still care about how I look, right? Like, there's an aesthetics part to working out and lifting and doing all this stuff, but more and more it's shifting to just my overall health of my system. I mean, we see so many discussions now about how important exercise is for your brain, for preventing things like diabetes and heart disease and Alzheimer's. I mean, all of these kind of chronic conditions that tend to kill us now are, you can drop the risk so much with just a little bit of exercise. And it doesn't even have to, sometimes it's just walking, you know what I mean? Just like try to get steps in each day. I literally have this watch that I only bought just to track steps, because during COVID, especially, I was finding I was way more sedentary. Couldn't go to the gym. I was here working on stuff, and I just noticed that my steps were way down. And so just having like an objective measure like that to get me going was really useful. And like you said, it will totally change my energy. I think people who have some experience exercising will know, like, you might feel kind of down and not into it. By the time you finish a workout, it totally changes your energy and mindset. And I often find that it motivates me, and I feel more inspired to kind of get on with the day and do other things.
So many things unpacked. Number one, I've never seen anyone regret a workout. Usually it's the other way around. I wish I went to the gym, or I should have went, or I shouldn't have hit snooze. But you'll never work out and feel worse.
Yeah, for
Right.
sure.
And just to be clear, yes, I do want to look good, right? Look good, feel good, and confidence and all that stuff. But I think that's just a byproduct of being consistent with working out. And then obviously nutrition plays a big role in that as well.
Huge. Yeah. Yeah. That's a huge element that a lot easier to take those calories in than to burn them. So a lot of discipline with nutrition.
Yeah, it's funny because I used to work out for 15 years and I was never like shredded. I was muscular. And then I finally got serious and organized about my nutrition and meal prepping it. And just like that, I got in the best shape of my life. I also started running around the same time. However, I was injured a few years back, freak thing. There was found a tumor in my foot and I had to get surgery, came back benign, all good. Still ran a marathon after that. But when I couldn't run, I stuck to the meal prep, and my physique stayed relatively the same. So nutrition really is a big component. And for anyone that's listening, that hasn't really doubled down on that, in addition to the fitness, I would suggest being a little bit more disciplined with it.
For sure. Yeah, we talk about nutrition a lot in terms of rehab, injury, and pain too. I mean, obviously, most people these days are thinking about nutrition in terms of body transformation and losing fat and things like that. Which, yeah, that's a side to consider and think about. But when we talk about pain and injury, yeah, these things like getting enough protein are huge. When your body's injured, your tissues, protein's a huge macronutrient in terms of building your body back. So making sure you get enough protein, and that you have the right amount of calories. I think a lot of people, they don't really estimate their caloric intake very well and what they expend. And so, that all these things are like, if you've never met with a dietitian or a nutritionist, it's something that's really helpful to add in, to have a plan, because most of us don't do a great job at, kind of calculating what we're actually taking in each day.
100%. So many places we could take this conversation. I want to make sure we hit on a lot of the really important stuff, make the most of our time. I'm curious, I'm sure the audience is too. What is the difference between acute and chronic pain?
Yeah. So when you look at those two, usually the definition is a time factor. So acute pains are those things that most people, the easiest thing they'll think of is like you had a injury, like you just sprained your ankle, or you had something that happened like in this second. It's immediate in terms of when it happened. And acute injuries will those can go obviously a few days, several weeks, several months. The cutoff is in the research. The cutoff is right around somewhere between 3 to 6 months. If the pain continues past that, then it will often fall into this chronic category. Now, the thing that's tricky about that is that there's a lot of acute pains that can last a long time, right? Like you can keep flaring them up. So I really try to help people understand that just because it's lasted longer than 3 months doesn't mean all of a sudden you have a chronic pain, because it goes back to that language idea. If you tell someone this is a chronic condition, they will think they can never get better. So tons of acute pains. I've got a hamstring injury right now that I've had for a year that I just keep flaring up because I don't take my own advice, and I keep running and stressing it more than I should. So it's not a chronic pain. It's meets all the characteristics and criteria of an acute pain thing. And so we look at time, but we also look at different factors. Like an acute pain is something that's very easy to turn on and off. It's typically very mechanical. Like you can stress your body in a certain way, move a certain way, get in a certain posture or position, and you can turn it on. If you get out of that, it goes away. it tends to stay in that same area, or maybe just within a few inches around it. Whereas something like a chronic pain becomes more vague and diffuse. It's more unpredictable. It has that time component where it's lasted longer. These will be things like fibromyalgia or something like that, where it's or chronic low back pain, where the pain response that you experience is not a good reflection of what's happening in your body, right? Like it's like this overblown response in the pain system. And that's the thing we really try to educate people on chronic pain, is that the pain, it's trying to help people understand that in those situations, that most tissues in the body heal within 3 months. So when you have these overblown, unpredictable pain responses, it's trying to help people understand that, yeah, we hear that you have this pain, but trying to help them understand that this is most likely not an accurate reflection of your body, and doesn't mean that you've injured something. A lot of people have pain without injury. And so it's trying to help people understand kind of that whole process from between acute and chronic pain.
You are so jazzed when you talk about this stuff. It's awesome. Straight up. You are doing exactly what you're supposed to
I
do.
told you I'm a nerd, full
So,
nerd.
so am I. I love it. And this conversation is so helpful to so many people. And I appreciate it. You mentioned a couple times that you run. I'm just curious, do you just like run to stay fit, or do you like run marathons, stuff like that?
No, I don't do anything really super long. I was a sprinter in high school, so I really don't like long distance running, but I do it because of basically the cardiovascular health benefits. There's all this research now on your cardiovascular capacity, right, as being one of the, I think, the most influential in terms of all-cause mortality. So I do a lot of it for, just my general cardiovascular fitness. There's brain health kind of factors associated with it. And I'm naturally a kind of spun up, anxious person. And I will notice that if I run, it kind of gets me back to normal. So I don't
Hey,
like it as much as the weight training and other things, but I do it because I see these other benefits.
understood. Love this so much. I know you do a lot of the step-by-step programs, which is awesome. I imagine you talk about a lot of those in the book. And I was checking out your content, which I would suggest everybody do immediately following this episode. And one of the things I saw that you talk about, and this is pretty cool, to be honest with you, I'm not 100% sure what you mean. I'd love to know, is you talk about not only increasing strength, but also tissue capacity. Can you tell us what that means?
For sure. I love you bringing that up. Yeah, that phrase gets used a lot in the kind of with amongst other clinicians in the PT world, but it's and it really fits really closely with strength training. If you look at any good physical therapy program, of course, in the beginning, you might have things like soft tissue work, massage, mobility work, things like that early on in the process. But every physical therapy program, as it gets later on, should be resistance training focused. We know that resistance training, putting load on your tissues, has some of the best evidence for almost every injury type. And increasing the capacity of tissue basically is the idea that that tissue can handle more stress or load without failing. And resistance training is one of the best because our musculoskeletal system is so cool in that our muscles, tendons, ligaments, our bones, they all adapt when you put progressive load on them, right? In weight training, they call it progressive overload. So if you go to the gym, you start out at a certain weight. If you stay consistent with it and you keep training, like maybe you're doing bench press, you stay consistent with that. Maybe you do it twice a week or something. Over time, if you track that, you'll be able to put more weight on the barbell as your muscles and tendons hypertrophy. So the same thing is true, just like you would look at it for performance. We'd also look at that for injury, reducing the risk of injury. The stronger those tissues are, the more resilient they are, the less likely they are to fail. So you're less likely to tear your Achilles tendon if you can do, 25 single leg calf raises. You're less likely to damage these tissues when the tissues have a greater capacity.
Yeah, this is so good and so helpful for people. I imagine people have been dealing with so many different things and probably just aren't informed to figure out like how to go about it and so forth. And one of the other things that you talk about it is how to educate yourself and get informed on whether or not you should have surgery or not. And this is a pretty controversial topic. And I don't want to give away too much because I want everyone to grab the book and so forth. But what is something somebody can do to be a little bit more educated in a big decision such as that?
Yeah. Yeah, that is a tricky one, right? And it varies so much from one body region and one diagnosis to another. But I think, a lot of that stuff is going to come down, surgery in particular. You really want to base it less on pain and more on if something that's damaged in your body is severely impacting your function, right? Like, if you have something like you tore your ACL, because we see even now that there are people who tear their ACL and their ACL heals. So there are some people who have these, we call them copers.
Without surgery?
Without surgery.
Wow.
There are some people, and we don't fully understand what factors go into who will heal and who won't, but there are individuals, even if they don't heal, who are called copers, who can use their neuromuscular system to stabilize their knee, even without an ACL. And then there are people who can't. So a lot of the decision to have surgery is based on your functional ability. So if you've got someone maybe who tore their ACL and a few months have gone by and their knee is still buckling and giving out, well, then that might be, that's maybe a good indicator to go think more about visiting a surgeon and kind of thinking about some other intervention besides exercise. We were talking about sciatica earlier, that one. With nerve pains, we really try to, with most of these things nowadays, the first step is rehab and exercise. Almost everything across the board in the musculoskeletal system. Very few of them are immediate surgery. So with like a nerve pain like sciatica, we really try to work with people for 6 to 8 weeks doing rehab-based things. And if at the end of that, they still have really severe pain, or if they start to notice that maybe their muscles that their nerve goes to the muscles are atrophying or becoming weak, then that might be a person who's a better candidate for surgery. And it's tricky to give a set of rules that apply to all these things. That's why in the book we really, for each of these diagnoses, try to give a section on when to see a specialist. And because there is so much in the body that if you give it time and you find exercises that kind of help challenge it in a gradual way, most things will get better. And I think that often is reassuring to people, is to know that most pain and injuries just get better with time, but you can speed that up and you can reduce your chances that thing happens again by implementing rehab exercises that improve the capacity of your system. So something like a book, that's why so many people look online at YouTube videos and social media and get better from them, because this stuff really can work. But if you don't get better, or you had a really like a severe trauma, like you got in a car accident or you heard something pop or tear, like those are times when you want to go see someone and rule out, more sinister kind of stuff that might need to be addressed from the medical system.
Yeah, this is so helpful, brother. I love all of this. I can't wait to share this episode because it helps so many people, especially with our audience and so forth. One of the cool things in this book that everyone's going to grab immediately, and I can't stress enough, is, correct me if I'm wrong, but you provide about 30 programs for the most common pain and injuries in every single body region.
Yeah, exactly. I think that's the part I'm really excited about. There's a body map in the book, and so it's on page 117. Basically, you go to that and it tells you what
page number.
I know it because I've had to talk about it a lot. We're going to actually, for the new prints, we're going back to print. We put it up by the table of contents because it shouldn't be that far back. But it's basically a body map, and it tells you what page to go for. So, you've got a neck problem, you've got a knee problem, you've got a shoulder problem, a low back problem. You know what page to go to. And then within each of those body regions the first page are a set of illustrations that outline which diagnoses are covered in that section. So if you go to the low back one, you would see general low back pain, sciatica. You'd see these different conditions that are the common diagnoses in that region. And then every single one has this 3-phase program. Like if you went to a physical therapist and they gave you a program, it's pictures of me doing the exercises. It kind of walks you through exercises that work best for those conditions. So, I think, like I said before, that's what most people will be excited about getting this book for. But I hope they will go back to the first 10 chapters and learn about the science of pain and injury, because that stuff really does change your mindset. And it helps you address these things because they will inevitably come up again. I mean, I'm a physical therapist and I have pains and injuries all the time. So nobody's immune to it.
Yeah, I would suggest everybody just I know it's, not the simplest read because it's a big one, but start from the beginning and just educate yourself. You're not going to regret it. And go in order. This way you can kind of get the foundation with some of the mindset stuff.
Totally. I mean, that'd be huge. Like if people do that, that's the best way to go about it. The chapters, you can start anywhere, but going through, we organize it the way it's organized for a reason. So
this is the go-to vessel. This is going to help the world. I can't wait to see how this does and how many people it's going to improve. We'll land the plane with this. I imagine a lot of people have this issue, and that's shoulder mobility. And I was checking out your content, and I saw you also talking about something like that. And I think that's something that a lot of people can probably resonate with. What is the deal with that? And how can maybe, what's a suggestion that someone can improve their shoulder mobility?
Yeah, that's a huge one. That's another one that's gets a lot of engagement, and I think it probably speaks to the fact that people struggle with shoulder mobility. We see a lot of people who have, your shoulder moves in a lot of different directions. It's a ball and socket joint. Some are hardly ever limited in people, and some are way more limited. So, for instance, a lot of people will have shoulder mobility restrictions with flexion, where they're going all the way up overhead. They could either be going out into abduction, out to their side, or straight up to the front into flexion. So we see people who have limited overhead mobility, or they get pain. They might get rotator cuff pain. Sometimes the bicep tendon will have pain up here on the top of their shoulder when they try to reach up. We also, probably the other big one is people having difficulties reaching behind their back. That's shoulder internal rotation. And so, there are ways, there are different stretches and even resistance training exercises to address these types of mobility deficits. And I cover, you know, exercises on my various social media channels for these things. But, sometimes it can be as simple as like, putting your back up against the wall or laying on a foam roller on your back and we'll have people saying do these kind of snow angels where they just lay on their back and just work through their range of motion. I mean, it's amazing. You can go your whole day and not fully use your shoulder all the way overhead through full flexion. The same is true for a lot of our joints. We're seated a lot of the day. A lot of people are seated. They're not taking their joints through all planes of motion and through full range of motion. Sometimes just having a practice, kind of a mobility practice where you take your joints through full range of motion, is huge in terms of, preventing stiffness as you age, because we do see a lot of older people that are really stiff. So just taking your body, just learning about kinesiology. I mean, this is what I taught for all those years. The kinesiology is the study of human movement. I just can't believe there's not more education for everyone on this stuff. It's literally your one body you've got for your whole life. Just learn a little bit about what movements your joints do. There's tons of resources out there. Like, what are the movements that my shoulder goes through? I'm just going to do those every day. I'll do like 10 reps in each direction.
Yeah.
It will be huge. If you did that for all your joints, split it up throughout the week, it'd be huge in terms of maintaining your mobility, reducing injury risk, and just being healthier.
Yeah. Well, you said that there should be more education on this. That's where you come in, and you're going to change the world. You already are. And you add so much value on all your content platforms. It's terrific. You mentioned being stiff. To be honest with you, I'm a little stiff. I need to be better at doing this. So I'm going to take your advice. So many nuggets. We got to bring you back for a sequel. This is awesome. I think I know the answer to this, but our audience is breaking out. They're very loyal and engaging. What's the best way for all of them to support you? Obviously, the book. And what else are you most excited about right now?
Yeah, the book is the biggest thing for sure. I mean, the book is called Rehab Science: How to Overcome Pain and Heal from Injury. It's my handle is Rehab Science everywhere. I'm mostly active on Instagram and YouTube, and so even people just following those channels, interacting. I try to respond to all the comments. But the book is really the biggest thing for me. I mean, you and I were talking before about kind of taking these leaps in life. And for a lot of years, up until the spring of 2019, I was a full-time kinesiology professor, and so I was doing some things on social media as sort of a hobby, but it really wasn't until COVID that I took the leap and went kind of full in on making Rehab Science my business. And, so this book is really kind of, for me, the launching point of this new business, which will down the road turn into continuing education courses, probably mostly for medical and movement practitioners, but maybe for the general public too. But just more of, like you said, more kinesiology education, more education on pain and injury, and how can we keep our physical body healthy. So, but the book is really the launching point. That stuff will come down the road.
It's so cool because it's very relatable to me. I was telling you, we have our first book coming out in August, and like, even though you and I have been doing this for years, right? But if for some reason, like, this book feels like an official introduction, it's a beautiful process. Yeah.
Yes. No, man, it's amazing. I'm so excited. Yeah. So thankful for the opportunity to be on here and chat with you, and hopefully it's helpful to your audience. And if they want, they can always find me, like I said, on Instagram, DM me on there. If they have questions about things, I can point them in the right direction. I've got so many videos at this point that almost everything's covered, and I can at least forward things.
Yeah. Hell yeah. Love all of this. Hang out for 1 second. I want to connect to you after. Doc, I
Yep.
want you to know you're the definition of knowledge, experience, and unbelievable energy. I could personally guarantee your best is yet to come. Keep on spreading your wings and leaving your mark on this world. So much love and respect for you. Thank you so much for stopping by and dropping these priceless, juicy nuggets today.
Thanks, Craig. Thanks, man. I appreciate it so much. Thank you.
That was terrific.
Dude, I hope it was you never know, like there's so many directions like you said you could go. So but I feel like we covered a lot of good things that will hopefully provide some value to people.
A lot of the things that I brought up were things that I think that can appeal to the masses.
Yeah. Yeah, and you know your audience. Like it's always kind of funny when you're coming into something not knowing what the person's audience is like. So
Yeah.
of course, like
It's
you
a lot
know
of
what they're
a lot of entrepreneurs, mindset, personal development. I run marathons. It's really all over, but all people that want to be better. And they get so excited when we bring on someone that's like niche. And obviously what you're doing is specific, but this is so helpful. I'm so proud of you. And I'm so excited to see how the book is going to just change everything for you. Well, you're already crushing it, but just enhance all the awesome stuff that you have going on.
Thanks, man. Yeah, I like I said, amazing opportunity to be on here. Thank you for all the support and feedback. And dude, let me know when your book comes out. Send one my way, and I'll share about it. So I don't
Yeah.
have a podcast that I can pump you, but I can at least do it on social media.
Yeah. I was surprised that you don't, but I guess you have so many other things going on.
What's that? Oh, a podcast? I know.
Yeah.
I've thought about it. I've thought about it quite a bit. My wife's a PT, so I would always think, dude, we could do a joint podcast and bring people in and talk about issues. So it might happen at some point. And I think I told you my publisher is sending you a book. So apologies
Yeah.
again. I all of a sudden it occurred to me
Oh,
today. I'm like,
good.
oh, dude, I didn't send one. So
Well, let's definitely do some more. Let's stay connected.
yeah, for sure. It'd be
You said
awesome, man.
it's you on your Instagram.
What's up?
It's you on your Instagram, not like a team.
No, it's just me. Yeah.
Same.
Yeah. Yeah. Isn't it funny? People, I mean, I get it. People, are like, hey guys, like plural. I'm like, no, dude, it's just Tom. It's me.
But I
Like,
could tell, like me, like you're very intentional and selective about your brand. It's your baby.
for sure. Yeah, man. I don't want to give up. I'm way too controlling and care about that quality too much to hand stuff over. And I don't know. I mean, at some point, I guess as it grows, that maybe as a product of growth, finding the right people who can handle some things, but it's hard for me to turn over right now.
Understood. Do you ever come out to New York?
Dude, I might actually come out there. I might go out there to do some PR stuff in the middle of June. My marketing gal is checking right now on opportunities out there, but I'll for sure, if I'm out there, let you know. My girls have never been there. We keep talking about it.
If we can make time for it, I'd love to grab a coffee. Can we exchange numbers?
For sure, dude. I'd love that.
Do you have
I
your
got
phone?
my phone right here. Yeah, let me I'll save you. I'm ready.